Hi everyone, welcome to PharmaGrid. So in our last session, we have discussed about fluid and electrolyte disorders, and today we are going to learn about acid-base disorders. So first of all, what do you mean by acids and bases? The substances which have more hydrogen ions that they can donate are called acids, and they are said to have a low pH. While the substances that can accept hydrogen ions are called bases and are said to have a high pH. So acids have low pH whereas bases have high pH. The fluids inside our body also have a pH level, according to which they are classified as acids and bases. This pH level needs to remain at the optimum level so that the physiologic process in our body can occur and our body can function normally. Any change in the amounts of acids and bases can alter this pH level, resulting in the disruption of the body's physiologic process, which will be evident clinically. The optimum pH of the body is tightly regulated between 7.35 to 7.45. So the normal body pH is in the range between 7.35 to 7.45. The partial pressure of carbon dioxide, which is denoted as PCO2, its normal range is between 35 to 45 mmHg. So this PCO2 or the partial pressure of carbon dioxide is considered as body's acid, and the concentration of bicarbonate in the body, which is denoted as HCO3 minus, its normal range is equal to 22 to 26 milliequivalent per liter, and this bicarbonate is considered as body's base. So the normal pH is in the range between 7.35 to 7.45, and the partial pressure of carbon dioxide is considered as body's acid, and the concentration of bicarbonate or bicarbonate is considered as the body's base. So as I have already mentioned, acids have low pH whereas bases have high pH. So if this pH level decreases, okay, pH level decrease means acidic property increases. So you are said to have acidosis in your body, and if the pH level increases, you are said to have alkalosis in your body. And one more thing, if the problem is due to partial pressure of carbon dioxide, then it is considered as respiratory acidosis or alkalosis. And if the problem is due to the bicarbonate levels or bicarbonate concentration, then it will be classified as metabolic acidosis or alkalosis. So if the problem is within the or problem is due to PCO2 levels, then it will be mainly respiratory related, okay, respiratory acidosis or alkalosis. And if the problem is due to the bicarbonate levels, then it will be metabolic, okay, either it can be metabolic acidosis or alkalosis. Whether it is acidosis or alkalosis, it will have consequences evident clinically. Our body is regulated by the homeostatic system, which means that there are mechanisms in the body that try to keep the general conditions of the body at optimum levels so that it works normally. So for acid-base imbalance, there is a buffer system in our body that tries to bring back the pH to normal levels whenever there is a disturbance. The buffer systems of the body are the carbonic acid bicarbonate buffer system, the phosphate buffer system, the protein buffer system. Bicarbonate acts as part of the carbonic acid bicarbonate buffer system, which is important to maintain acid-base balance and thus the pH of the blood. pH homeostasis is accomplished through the interaction of lungs, kidneys and blood buffers. This interaction is best represented by the Henderson-Hasselbalch equation, an equation by which the pH of a buffer solution, blood plasma being 1, can be determined. So here you can see the Henderson-Hasselbalch equation. Okay, so here is the bicarbonate concentration and the partial pressure of carbon dioxide. So the plasma bicarbonate is controlled mainly by the kidney and the blood buffers, whereas the lungs control the partial pressure of carbon dioxide. So here you can see the normal blood gas values in arterial blood as well as mixed venous blood. So the pH, it's normal within the range of 7.35 to 7.45. In the arterial blood, its value is 7.40, and in the mixed venous blood, it will be 7.38. Then partial pressure of oxygen, 80 to 100 mmHg or 10.6 to 13.3 kilopascal. Then SA2 means saturation of arterial oxygen, 95%. Then partial pressure of carbon dioxide, 35 to 45 mmHg or 4.7 to 6 kilopascal. Then bicarbonate levels, 22 to 26 milliequivalent per liter or 20 to 26 millimole per liter. So these are the normal blood gas values. So acid-base disorders are pathologic changes in carbon dioxide partial pressure, that is PCO2, or serum bicarbonate levels that typically produce abnormal arterial pH values. Acidemia means serum pH is less than 7.35. Alkalemia means serum pH is higher, that is greater than 7.45. Acidosis refers to physiologic process that cause acid accumulation or alkali loss. Alkalosis refers to physiologic process that cause alkali accumulation or acid loss. Arterial blood gases. So this arterial blood gas analysis provides a rapid and accurate assessment of oxygenation, alveolar ventilation and acid-base status, the three processes which maintain pH homeostasis. The maintenance of arterial carbon dioxide retention depends on the quantity of carbon dioxide produced in the body and its removal through alveolar ventilation. High PaCO2 that is greater than 6.1 kilopascal indicates alveolar hypoventilation and low PaCO2 that is less than 4.5 kilopascal implies alveolar hyperventilation. Hypoventilation means reduced respiratory rate whereas hyperventilation means increased respiratory rate. The adequate delivery of oxygen to the tissues depends upon the cardiopulmonary system, arterial oxygen tension that is PaO2, oxygen concentration in inspired air and hemoglobin content and its affinity for oxygen. Oxygen saturation is measured by pulse oximetry or by arterial blood gas analysis. Hypoxemia is defined as PaO2 of less than 12 kilopascal at sea level in an adult patient breathing room air. So in this slide, you can see the analysis of arterial blood gases. So here you can see the pH. Okay, the normal pH is within the range of 7.35 to 7.45. If the pH is less, okay, less than 7.35, it is known as acidemia or acidosis. And this acidosis can be further classified into respiratory as well as metabolic acidosis. Respiratory acidosis, when it will happen? When there is an increase in the partial pressure of the carbon dioxide level, because partial pressure of carbon dioxide is considered as the body's acid. Okay, if acid level increases, there will be acidosis. Then metabolic acidosis means if there is a decrease in the bicarbonate level, because bicarbonate is considered as the body's base. Okay, bicarbonate is considered as the body's base. And if the pH is greater than 7.45, then it will be alkalosis or alkalemia. And this alkalemia can be further divided into respiratory alkalosis or and metabolic alkalosis. Respiratory means it is related to partial pressure of carbon dioxide. In alkalosis, there will be decrease in the partial pressure of carbon dioxide. Then metabolic means it will be related to the bicarbonate levels. In metabolic alkalosis, there will be increase in the bicarbonate levels. And here you can see the symptoms of acidosis as well as symptoms of alkalosis. And the acidosis symptoms mainly include headache, sleepiness, confusion, loss of consciousness, coma. Then in the respiratory system, there will be shortness of breath and coughing. And in the heart, it can cause arrhythmia, increased heart rate, then seizures, weakness. In the digestive system, mainly nausea, vomiting and diarrhea. Then about this alkalosis, in the CNS, it can cause confusion, lightheadedness, stupor and coma. Then peripheral nervous system. The main symptoms include hand tremor, numbness or tingling in the face, hands or feet. Then twitching or prolonged spasms in the muscular system. Then digestive system, mainly nausea and vomiting. So the classification of acid-base disorders. Primary acid-base disturbances are defined as metabolic or respiratory. Okay, as I have already discussed with you, that is metabolic means that related to bicarbonate levels and respiratory means related to the partial pressure of carbon dioxide levels. So based on this, okay, based on whether the problem is due to the carbon dioxide levels or due to the bicarbonate levels, acid-base disorders can be divided into four. Okay, that is mentioned here. The primary acid-base disturbances are defined as metabolic or respiratory based on clinical context and whether the primary change in pH is due to an alterations in the serum bicarbonate or in the partial pressure of carbon dioxide level. So, under metabolic, there will be metabolic acidosis and a metabolic alkalosis. Metabolic acidosis means serum bicarbonate level less than 24 milliequivalent per liter or less than 24 millimole per liter. The causes are mainly increased acid production, acid ingestion, decreased renal acid excretion, then gastrointestinal or renal bicarbonate loss. Next one is metabolic alkalosis. Here, serum bicarbonate levels greater than 28 milliequivalent per liter or 28 millimole per liter. The causes are mainly acid loss and bicarbonate retention. Then under respiratory, there will be respiratory acidosis and a respiratory alkalosis. Respiratory means mainly related to the partial pressure of the carbon dioxide levels. So in respiratory acidosis, the PCO2 is greater than 40 mmHg. That is hypercapnia. The cause is mainly decrease in minute ventilation or hypoventilation. Hypoventilation means decrease in the breathing rate. Respiratory alkalosis means PCO2 or the partial pressure of carbon dioxide is less than 38 mmHg or known as hypercapnia. Here the cause is increase in minute ventilation, that is hyperventilation or increase in the breathing rate. Now we will see each disorders in detail. So first of all, metabolic acidosis, also known as primary bicarbonate deficiency. Metabolic acidosis occurs when the blood is too acidic, that is pH below 7.35, due to too little bicarbonate, a condition called primary bicarbonate deficiency. Metabolic acidosis are categorized as high or normal anion gap based on the presence or absence of unmeasured anions in the serum. At the normal pH of 7.40, the ratio of bicarbonate to carbonic acid buffer is 20:1. If a person's blood pH drops below 7.35, then he or she is in metabolic acidosis. The most common cause of metabolic acidosis is the presence of organic acids or excessive ketones in the blood. So in this table, you can see the common causes of metabolic acidosis and blood metabolites. So here you can see the cause as well as the metabolite. So in diarrhea what will happen? There will be excess bicarbonate will be lost. Okay, so the bicarbonate is the metabolite formed in diarrhea. Then in uremia, the metabolites formed are phosphoric, sulfuric and lactic acids. Diabetic ketoacidosis, there will be increased ketones. Then strenuous exercise will lead to the production of lactic acid. Then methanol, the metabolite formed is formic acid. Then paraldehyde, it will lead to the formation of the metabolite beta hydroxybutyric acid. Isopropanol, propionic acid. Then ethylene glycol, the metabolites formed are glycolic acid and some oxalic and formic acid. Then salicylate or aspirin, the metabolite formed is sulfur salicylic acid. So all these metabolites are, except this bicarbonate, all these metabolites are acidic in nature. Okay, hence the most common cause of metabolic acidosis is the presence of organic acids or excessive ketones in the blood. Then in diarrhea, there will be excessive loss of bicarbonate. Okay, excessive loss of bicarbonate. Hence it became the reason for metabolic acidosis. Strenuous exercise can cause temporary metabolic acidosis due to the production of lactic acid. The active form of aspirin is its metabolite sulfur salicylic acid. An overdose of aspirin causes acidosis due to the acidity of this metabolite. Metabolic acidosis can also result from uremia, which is a retention of urea and uric acid. Metabolic acidosis can also arise from diabetic ketoacidosis, wherein an excess of ketones is present in the blood. Other causes of metabolic acidosis are a decrease in the excretion of hydrogen ions, which inhibits the conservation of bicarbonate ions, and excessive loss of bicarbonate ions through the gastrointestinal tract due to diarrhea. Symptoms and signs in severe cases include nausea and vomiting, lethargy and hyperapnea. Diagnosis is clinical and with arterial blood gas and serum electrolyte measurement. The first of all, the cause is treated, and also we can use IV sodium bicarbonate may be indicated when pH is very low. Lactic acidosis is a high anion gap metabolic acidosis due to elevated blood lactate level. Lactic acidosis results from overproduction of lactate, decreased metabolism of lactate or both. So the next acid-base disorder is metabolic alkalosis or primary bicarbonate excess. Metabolic alkalosis is the opposite of metabolic acidosis. It occurs when the blood is too alkaline, that means the pH above 7.45 due to too much bicarbonate, called primary bicarbonate excess. A transient excess of bicarbonate in the blood can follow ingestion of excessive amounts of bicarbonate, citrate or antacids for conditions such as stomach acid reflux known as heartburn. Cushing's disease, which is the chronic hypersecretion of adrenocorticotropic hormone, that is ACTH, by the anterior pituitary gland can cause chronic metabolic alkalosis. Other causes of metabolic alkalosis include the loss of hydrochloric acid from the stomach through vomiting, then potassium depletion due to the use of diuretics for hypertension and the excessive use of laxatives. The underlying condition is treated. Oral or IV acetazolamide. Acetazolamide is a carbonic anhydrase inhibitor, or hydrochloric acid is sometimes indicated. So the next one is respiratory acidosis or primary carbonic acid bar carbon dioxide excess. Respiratory acidosis occurs when the blood is overly acidic due to an excess of carbonic acid resulting from too much carbon dioxide in the blood. Respiratory acidosis can result from anything that interferes with the respiration such as pneumonia, emphysema or congestive heart failure. Respiratory acidosis can be acute or chronic. The chronic form is asymptomatic, but the acute or worsening form causes headache, confusion and drowsiness. The cause is treated. Oxygen and mechanical ventilation are often required. Now, respiratory alkalosis or primary carbonic acid bar carbon dioxide deficiency. Respiratory alkalosis occurs when the blood is overly alkaline due to a deficiency in carbonic acid and carbon dioxide levels in the blood. This condition usually occurs when too much carbon dioxide is exhaled from the lungs, as occurs in hyperventilation, which is breathing that is deeper or more frequent than normal. An elevated respiratory rate leading to hyperventilation can be due to extreme emotional upset or fear, fever, infections, hypoxia, or abnormally high levels of catecholamines such as epinephrine and norepinephrine. Surprisingly, aspirin overdose, known as salicylate toxicity, can result in respiratory alkalosis as the body tries to compensate for initial acidosis. Respiratory alkalosis can be acute or chronic. The chronic form is asymptomatic, but the acute form causes lightheadedness, syncope, confusion, paresthesias, and cramps. So we have discussed about the four acid-base disorders, metabolic as well as respiratory, acidosis and alkalosis. Now regarding the compensation mechanisms. Various compensatory mechanisms exist to maintain blood pH within a narrow range including buffers, respiration and renal mechanisms. Although compensatory mechanisms usually work very well, when one of these mechanisms is not working properly, like kidney failure or respiratory disease, they have their limits. If the pH and bicarbonate to carbonic acid ratio are changed too drastically, the body may not be able to compensate. Moreover, extreme changes in pH can denature proteins. Extensive damage to proteins in this way can result in disruption of normal metabolic processes, serious tissue damage and ultimately death. So these compensatory mechanisms are really important. So there are mainly two types of compensation, that is respiratory as well as metabolic. So respiratory compensation for metabolic acidosis increases the respiratory rate to drive off carbon dioxide and readjust the bicarbonate to carbonic acid ratio to the 20:1 level. This adjustment can occur within minutes. Respiratory compensation for metabolic alkalosis is not as adept as its compensation for acidosis. The normal response of the respiratory system to elevated pH is to increase the amount of carbon dioxide in the blood by decreasing the respiratory rate to conserve carbon dioxide. There is a limit to the decrease in respiration, however, that the body can tolerate. Hence, the respiratory route is less efficient at compensating for metabolic alkalosis than for acidosis. So, for this metabolic related acid-base disorders, mainly respiratory compensation will occur. Metabolic compensation. Metabolic and renal compensation for respiratory diseases that can create acidosis revolves around the conservation of bicarbonate ions. In cases of respiratory acidosis, the kidney increases the conservation of bicarbonate and secretion of H+. These processes increase the concentration of bicarbonate in the blood, re-establishing the proper relative concentrations of bicarbonate and carbonic acid. In cases of respiratory alkalosis, the kidneys decrease the production of bicarbonate and reabsorb H+ from the tubular fluid. These processes can be limited by the exchange of potassium by the renal cells, which use a potassium H+ exchange mechanism known as the antiporter. So here is a summarization of acid-base disorders. That is, the primary disorders can be classified as four. That is metabolic acidosis, metabolic alkalosis, respiratory acidosis and respiratory alkalosis. So here the problem is mentioned. In metabolic acidosis, there will be gain of H+ or loss of bicarbonate. So here what will happen to pH? It is acidosis. Okay, so pH will decrease, bicarbonate will decrease, and this is the compensatory mechanisms which is denoted in an asterisk. So the compensatory mechanism is decrease in the partial pressure of carbon dioxide level. Then metabolic alkalosis. Here is there will be gain of bicarbonate or loss of H+. So it is alkalosis. So pH will increase, bicarbonate level will increase. As a compensatory mechanism, partial pressure of carbon dioxide will increase. Then coming to the respiratory acidosis. The primary disorder, the problem is hypoventilation. Hypoventilation means decreased breathing rate. It will lead to retention of carbon dioxide in the body. It is acidosis. Acidosis means there will be decrease in pH, and respiratory means it is related to the partial pressure of carbon dioxide. So PaCO2 will increase. The partial pressure of carbon dioxide will increase in the respiratory acidosis. As a compensatory mechanism, bicarbonate levels will increase. Then in respiratory alkalosis, it is due to hyperventilation or washing carbon dioxide out of the body. It is alkalosis. So what will happen to pH? pH will increase. Then what about PaCO2? Partial pressure of carbon dioxide will decrease. As a compensatory mechanism, bicarbonate level will decrease. Okay, so this is the summarization of acid-base disorder. So here those that I have marked in the asterisk, it is the compensatory response. In metabolic disturbances, respiratory compensation is almost immediate, while in respiratory disorders, compensatory changes in bicarbonate occur via long-term adjustments by the kidneys mainly. So again in this slide I have mentioned one more diagram for simplifying the interpretation of acid-base disorders. Okay, so this acid-base disorders are classified as mainly acidosis and alkalosis, and under acidosis there will be respiratory and metabolic. Respiratory means related to the partial pressure of carbon dioxide level, which is considered as the body's acid, and metabolic means related to the bicarbonate level, which is considered as the body's base. Okay, so acidosis means pH level will decrease and alkalosis means pH level will increase. And here you can see the primary disturbances related to each acid-base disorder and what all are the compensatory mechanisms. So we have completed acid-base disorders. If you require more clarification or more details, you can refer Dipro's textbook of pharmacotherapy. So thank you everyone for watching this video. Hope you like this video. Please like, share and subscribe. So thank you everyone. Have a good day.